Hello, my name is Irene Winfield. I'm doing the first exam for nursing 650 health assessment. Today I'll be looking at this general appearance, hair, skin, nails. I'll be looking at eye, ears, nose and neck. I have here Mr. Frankie Eboa. Frankie, do I ask for your verbal consent to do this assessment on you?
Yes.
And Frankie is only 15, so I consent as a mother too. I'm going to start off, Frankie, by washing my hands, okay? Frankie is 15 years old. He's 130 pounds, 5 foot 4 inches tall. His BMI is 22. He's pleasant. He looks well groomed. He's well appearing. I'm going to start off, Mr. Yeboah, with your hair. I'm looking at the distribution of your hair. I'm checking the texture of your hair. I'm looking for any pattern of hair loss. I'm checking for masses. I'm looking for any lesions that I may find. I'm looking right at your scalp now, okay? I'm going to check for any masses, any lesions. I'm checking at the size of your scalp. I'm looking for any deformities. I'm looking for any depression in your scalp, for any tenderness. Does it feel tender when I touch it?
No.
All right. I'm going to move to your skin now. I'm checking the temperature and checking your skin for any dryness, checking the moisture, the texture of your skin. All right, can I see your nails now? I'm checking for clubbing in your nails, for any cyanosis, checking your capillary refill. Can I see? Thank you. Alright, I'm going to move to your eyes now. And in your face, actually, I'm checking for symmetry, checking for any masses, looking for any involuntary movement in your face. I'm looking at the contours in your face, looking for any lesions. Alright. I'm going to next go to your eyes, and in your eyes I'm inspecting your eyelashes, your eyebrows. I'm looking at the direction of your eyelashes, your eyelid. Sorry, are you okay? Your eyelids. I'm going to wash my hands. I'm going to touch your face, okay? I'm pulling down. Look out for me to check your conjunctiva and your sclera. I'm checking your lacrimal apparatus, your palpebral fissures. Okay, I'm going to use this pin light to look at your eyes. I'm going to check your cornea, your pupils, your iris, checking at the size of your pupils, which is about 5 millimeters. Okay. Sorry. Checking for any opacities, any discoloration, any discharge, any masses, anything I see on the eye. I'm going to turn the light off, Frankie, and I'm going to check your pupillary reaction, okay, to light. And with that, I'm going to do direct and consensual. Okay, look at me. This is direct, and consensual will be looking at the other eye. I'm going to move on to the other eye. This is direct, and this is consensual, looking at the other eye. Thank you. Turning the light back off. I'm going to check your pupillary reaction to confrontation. And with that, I want you to look at me, and I'm going to wiggle my hands around you. I want you to tell me when you see my hands, okay? Do you see my hands? Do you see my hands? All right, that was your reaction to confrontation. I'm going to check your accommodation, and with that, I want you to look at this pencil. Okay, that was your accommodation. I'm going to look at your visual acuity, and that I have this Snellen chart. And I'm going to hold this, look straight at it, and you tell me, turn a little bit so you can see. Tell me the least line, the letters you can read with one eye closed. Tell me.
LTFPH.
Okay. And go to the other one, block it. And then tell me what you can read the least.
LTFPH.
So under normal circumstances, you'll be reading this from a 20 feet distance, okay? And if you're able to get the last one, which is 20/20, it means your vision is good. Your vision is 20/20. I'm going to move on to your extracurricular activities. And with that, I'm looking for convergence. I'm looking for any nystagmus in your eyes. I'm going to check any lid lag in your eyes, okay? And with that, just look straight at me. I'm going to move my finger and just follow my finger with your eyes, okay? Okay. Good. The last thing I want to do is look at your eye more carefully. So I'm going to use this little device called the ophthalmoscope, and I'm going to check for your optic disc, your red reflex. I'm going to look at the vascularity in your eye. It's a bit uncomfortable, so bear with me, okay? All right, I'm going to do the right. Okay. Open. Okay, I see the red reflex. See the optic disc. Okay. Going to do the same thing in the other eye, okay? Okay, looking for the red reflex, the optic disc, the vascularity, the macula. All right, thank you. Okay, I'm going to move on to your ears. Going to check your auricles, looking at symmetry, checking for any lesions, any masses, any nodules. Okay, I'm going to take a closer look by using this otoscope, okay? Putting a new cover on it, and alrighty. Okay, I'm going to position you and look into the ear canal. I'm pulling your ear back and up so I can have a better look. Checking for any redness, any discharge, any cerumen, any foreign material. Okay, moving on to the other ear. Pulling it back and up. All right, thank you. I'm going to do a whisper test. See if you can hear well, okay? I'm going to stand behind you. I'm occluding one ear.
Today.
Okay, going to the other one. Occluding this.
It's the same.
Okay, all right. I'm going to do the Weber test, what we call Weber test, to make sure that there is lateralization in the sound, okay? And with that, I'm going to vibrate this and put it here, and tell me if you hear it in both ears at the same rate, at the same sound. Okay, all right. The next thing I'm going to do is your bone conduction and your air conduction. I'm going to strike this again and then put it behind you. Tell me when you stop hearing
I don't hear it.
it. Did you hear it in the first place? Okay.
Yes.
Do you hear it now?
Yes.
Alright. So tell me when you stop hearing it.
I don't hear it.
But you heard it. Do you hear it now? Alright, that was your bone conduction and your air conduction. Okay. I'm moving on now to your nose. I'm going to check your nose with my hands washed. Touch for any tenderness, for symmetry, for any discharge, any redness, and I'm going to use this to help me see better. Okay, changing the probe now. Okay, it's checking for any discharge, any redness, making sure your septum is midline, there is no deviation in your nose. Alright, monkey, relax. Alright, I'm going to check your smell as a factory nerve, and I want you to tell me what you smell here.
Hand sanitizer.
What flavor?
Watermelon.
Yes, it's a watermelon flavor. Yes. The next thing I'm going to do is check your sinuses, and I'm going to check your frontal and your maxillary sinuses. Okay, this is your frontal for tenderness. Tell me if you feel tender. It does?
No.
Okay, that's your maxillary. You okay? It feels tender?
No.
Okay. I'm going to now move on to your mouth, and with your mouth I'm going to wear a pair of gloves. Alright, Frankie, I'm going to check your lips. Make sure they are both symmetrical. I'm checking for any crack, any dryness, any scaliness in your lip, any lesions, any masses, any ulcers. Alright, I'm going to open your mouth now and look in your oral mucosa, checking for coloration, and I can use this light to help me see better. Checking for coloration, making sure there are no ulcers, any white patches in your mouth and your tongue. I'm looking for your hard palate, making sure your pharynx is there. Stick your tongue out a little bit. Okay. Alright, look down now. Looking for your uvula, your soft palate, making sure it's bilateral, it's moving up and down. I'm checking for your dentition. I'm making sure there is no loose tooth, no retraction. Checking your gums, checking for coloration, any inflammation that might be up there. Checking the texture of your tongue and the color of your tongue. Check it out. Okay. All right. Thank you. I'm going to move on to your neck, and I'm going to palpate. Look for any masses. Any bulging of lymph nodes. Looking for any tenderness. Alright, I'm going to now palpate your lymph nodes. Alright. Starting off by going to your preauricular, in front of your ears, looking for movement, looking at the size, tenderness. Okay, going back to your post-auricular lymph nodes behind the mastoid process. I'm going to the occipital lymph nodes now. Okay, coming down the tonsillar lymph nodes, and then the mandibular lymph nodes. I'm going down to your submental right here below your chin. Okay, I'm now going to the superficial cervical lymph nodes. That's here, and the deep ones are in there, going down to your clavicle. All right, I'm now going to check your trachea, okay, and make sure there is no deviation. All right, it's there, it's in the middle, no deviation. The last thing I want to check, Frankie, is your thyroid glands. Frankie, can you swallow? Alrighty, thank you very much. I think that's the end of the exam. Thanks for your help, okay?